Mula sa Asian Community Development Council, ito ang Fil-Am in Focus. Mondays at 12 noon, right here on PHLV Radio.
Good afternoon, everyone, and welcome to Fil-Am in Focus, a program by the Asian Community Development Council, or ACDC, where we discuss critical issues, challenges, and opportunities affecting Filipino Americans. Ako po ang inyong host, Edelvi Solano. I'm excited to engage in meaningful conversations that highlight the Filipino community and its unique experiences and insights. And the critical issue that we will be discussing today is about impacting your health without you even realizing it. And what we will be discussing again is yung sa ating mga komunidad, at marami po sa atin ang hindi nakakaalam ng mabuting epekto ng health insurance lalo na sa ating buhay, at maaari itong makahantong sa malalang problema sa ating kalusugan. At ito ay makakaresulta ng malaking gastos at problemang financial. So let's unpack this issue and consider its implications for your health and the health of the people around you. So in today's episode, we will be speaking with one of our close partners at ACDC, Molina Healthcare. Molina Healthcare of Nevada is dedicated to providing affordable and quality health coverage. And joining us today is Kim Gehagan. She's the Associate Vice President of Growth and Community Engagement. She'll share insights on how Molina is working to improve health equity and supporting communities, especially the Filipino community here in Southern Nevada. So let's dive into the conversation. So Kim, welcome to Fil-Am in Focus. I remember last year, it's about the same time, October, that we had this discussion.
Yes, that's right. Thank you for having me, Weiss.
Oh, likewise. I'm again excited because the last time we actually had an event together was during our community resource fair. So it was a fun event.
That's right. Molina was able to be a sponsor for the Asian Community Development Center Resource Fair, where you had great services. You had SNAP. You helped people enroll in SNAP. You had COVID and flu vaccines. You had voter assistance, citizenship assistance, and all kind of additional resources. And Molina was so proud to be a sponsor of that event.
Oh, thank you very much for your support. And you came in ready with all your jungle outfit, and then all those the animals that were hanging on your booth. That was amazing. So thank you so much. Again, if you can tell us what Molina is all about, so our audience can learn more about Molina Healthcare of Nevada.
Of course. So Molina is a health insurance plan, and we are focused on caring for individuals that are enrolled in government programs like Medicaid, Nevada Checkup, Medicare, and Marketplace plans. Molina's mission is to really improve the health and lives of our members by helping them improve their lifestyle.
So what are the other programs that you offer?
So Molina is committed to Nevada. We partner with community partners, but we also have our services that we offer. So obviously we offer the health insurance plan, and it covers medical services, but it also covers value-added benefits and things that maybe not as many people are aware of. So we have things like preventative well checks that people will get an incentive for. So kids 3 to 20, if they are a Molina member and they get a well check, then they can get $100. And it's loaded onto a reloadable debit card. And that is a brand new way that we've allowed our members to get their incentives, and they can now use that reloadable card for online purchases. They can use it in store. They can also use it for gas at the pump, and they can use it for bill pay, which is a new benefit as well.
Oh, and that bill pay just was initiated this year?
In June of this year, we just added that as a response to the needs in the community. We heard people saying that was really something that was missing, that they needed help with. There weren't as many resources available for that. And so we added that as an option. For adults, if they go and get their well check visit, they can get $75 loaded on the card. And those are just a couple of examples of many, many value-added benefits or extras at no cost to members that they can get. They can also get a free Sam's Club membership. So there's a lot of benefits. We would love for people to check them out as a Molina member.
So how can our community learn about the benefits that Molina Healthcare offers?
So the best resource is the website, which is molinahealthcare.com/NV. And they can go on there and scroll the website. All of the information is on there. They can also look up a provider. So if they're wondering if their provider is in network, they can they can scroll down to the bottom of the website and see the provider lookup tool and click on that. They can also see things like the preferred drug list. So if they want to know if their prescriptions will be covered by Molina, then they can scroll down and look at the preferred drug list. There's also things like our member handbook is available on there, and they can see the whole list of services and benefits and resources that are offered through Molina Healthcare of Nevada.
So it's very accessible and easy to navigate your website, aside from contacting their broker or any health insurance agent.
That's correct. That's correct. So it's accessible to anyone. You do not have to be a member to go onto the public website. And then we also have interpreters as well. So if someone needs a different language, then they can ask for member services, which the number is 833-685-2102. And they can request any language of interpretation, and the member services agent will get the translator on the phone and stay on the phone with that member while they speak to member services. They can also request that someone go to their appointment with them in person if they need another language. And so that is also covered free of charge for Molina Healthcare. We just have to book that in advance. So that's just a request into member services, and they can have someone attend with them if there may be a language barrier about them understanding the advice from the medical provider.
Yes, because health insurance terms are very hard to understand, and especially for some of our communities with limited English, who are limited English proficient, having those free services in different language are very helpful. So I'm glad that Molina Healthcare of Nevada has that free resource for our community. So, and that is the reason why at ACDC also we have bilingual staff. We have licensed health navigators that provides these services to them. We have Tagalog speaker, Vietnamese speaker, Mandarin speaker, so that they be able to help them understand those medical terms. And I'm glad you pointed that out, and happy that Molina considered providing translation services, and free of charge as well. That's excellent.
Yes, and we also have translated some of our printed material. All of it is in English and Spanish, but we have translated some really important documents like our redetermination that talks about renewals of Medicaid that's required every year now. We've translated those into some of our Asian languages, Chinese, Vietnamese, and Korean, and also our benefits brochures that are available for people who may need to enroll in Medicaid and they don't know how to go about it. Our benefits brochures are also available in some of the Asian languages. We've translated them based on a need for the community. And we can also translate any of our printed materials based on as needed basis. If someone requested something be printed in another language, we can definitely accommodate that.
Yeah, that's right. Well. That's right. And I remember even from last year, you have sent us some of those translated languages.
Yes.
The brochures in different languages.
That's right.
And why do you think it is important to have culturally and linguistically translated materials?
It's just really important. We have such a diverse population in all of our plans, in Medicaid as well as our Medicare program, which focuses on the dual special needs, the Medicare and Medicaid eligible, and also our marketplace plans. I mean, Nevada is a diverse state, and Molina Healthcare of Nevada is here to fulfill the needs for the community. So we are adapting as the needs in the community arise. And we just think it's very important that people understand how to navigate their services and their resources. There's so many things available to them, and we want to help them in any way we can to understand it better.
Right. And that is how, not only that you are fulfilling the need, but that is how Molina is supporting the community. And what are the other ways that Molina is supporting the Nevada communities, both in southern and the north?
Yes, we are in Clark and Washoe County. Molina believes everyone deserves to be healthy, and that's why we're investing in our communities. This year, we donated $2.8 million to local community organizations and providers to increase things like access to care for mental health services for adolescents, addiction care for adults, maternal health, and also other basic needs to help people support healthier lifestyles. We partner with our community organizations like the ACDC to overcome challenges for what we call social determinants of health, things like food and basic needs. We've also hosted this year quarterly diaper giveaways as a response to a need in the community. So we knew that diapers were not covered in a lot of different areas, and so we're hosting free diaper giveaways. We've also hosted some shoe giveaways, again, to meet a need in the community. And we're just so grateful to have organizations like the ACDC in our community that really share the same values that we have to improve the lives of our communities.
So you're being responsive to the needs of the community. So you've been highlighting that.
That's correct. That's correct. And we're committed to Nevada. Molina Healthcare of Nevada has been here since 2022. But we are really working hard with our partners to address those needs in the community.
And you said earlier, ACDC and Molina really shares the same value because we have that community responsive approach for our communities.
That's right.
Yes.
That's right.
And then what are also, you mentioned earlier a lot of the ways that you provide care for its members. And can you talk more about the community or Care Connections program?
Yes, of course. So Care Connections is a specific Molina Healthcare of Nevada program that has nurse practitioners who provide wellness visits and preventative care in members' homes. So members can get assessments, they can get well checks, they can get what we call closures of gaps in care. So certain preventative services that we know a specific member may need based on their health conditions. And they are boots on the ground. So they live here in our communities in Nevada, and they will go into the members' homes. Members can call to schedule an appointment with Care Connections at 844-847-9954 to schedule an appointment.
Okay. All right.
We also offer immunization. So immunizations are covered. So any CDC recommended vaccines are covered through the Molina Health Plan. And then we talked about the network providers, but our providers are actually the ones delivering the care. And so really important for members to check on their providers in network. And if they need help scheduling appointments, they can get help from member services. The number 833-685-2102 if they need help scheduling a specialist or a primary care appointment, or they'd like to change their primary care physician. Those are all things that member services can assist with.
And then they could easily look at their membership card and then call the membership services in order to find if their provider is in network. Aside from navigating your website, which is, you talked about it earlier, it's going through that provider list.
Yes, that's correct. And we also have a care management team as part of Molina Healthcare of Nevada. And the care management team really focuses on that one-on-one need for our members that may need a little bit of extra help. And so the care management team is really crucial. Our members are really at the center of all that we do. And the care management team, it leads the help for the members that need a little bit extra.
Right. And immunizations, you said it earlier.
Yes.
It's flu season, so definitely a lot of our community members will need to get vaccinated. So does that include COVID-19 as well?
Yes, those vaccines are covered. Anything that's recommended by the CDC is covered, including COVID and flu vaccines.
Okay.
That's correct.
For the adult vaccines.
Yes, for the adult. And anything that's recommended by CDC for the adolescents as well would be covered through Molina Healthcare of Nevada.
Okay. And Medicare open enrollment started in October 15.
Yes, so the annual enrollment period for Medicare runs October 15th through December 7th. So Molina Healthcare of Nevada is excited to have a plan that focuses on the dual special needs plan. So that is people who have Medicare and Medicaid. We offer some great benefits for that plan, including $60 for transportation or over-the-counter items, so drugstore type items that members may need. That they can't maybe get there to pick them up. Those can be delivered to their home.
Nice. And then not only do you help with Medicare, as well as, because I'm more familiar with the open enrollment period, which starts November 1st and runs through January 15.
Yes.
And you do have also licensed navigators, or at least you're part of now, because last year I believe you're still working on, is that correct, being part of the marketplace?
So last year we launched our first plan on the marketplace.
Okay.
Well, this year for 2024. 2024 we launched our first plan, but we're excited to have different plans for the 2025 year. So please take a look at the marketplace plans on the Health Exchange for Molina. We, as a new plan, have taken our lessons learned, our feedback from our community, including ACDC and our members, and we've really made some improvements in all of our lines of business, including Medicaid, our dual special needs plan, and our marketplace plan. And so we are excited to see to show you the new and improved things that we offer this year on the exchange.
Yes, well, thank you for clarifying that. And yes, so, because yes, definitely for our mga kababayans, you can ask for help from ACDC, and we can help you navigate through the marketplace on your health coverage, either from other not only Molina, but other health insurance carriers as well. So we will be happy to guide you through the health insurance enrollment process. So again, talk to us about the other languages offered by Molina.
Yes. So we have, with our translation services, we can really cover any language, including sign language. If someone needs in-person sign language, someone to go to their appointment with them, we can cover that. We sometimes get that question. We do have a means to translate our website based on Google Translate, and so they can access their information on the website based on Google Translate. And I don't know of a single language that anyone has ever requested that we haven't been able to fill with our translator. And so it's some 200 plus languages that can be covered based on our translation services that members need. So I think that's really important to members feeling comfortable and understanding how to navigate their services.
Wow, you're all set and ready to really serve the community.
Yes, we are. We're passionate about it, and we are ready to serve the community.
No, well, that's good to know, Kim. And we talked about Medicare, talk about the qualified health plan under the marketplace. How
Yes.
about Medicaid? What is the process in enrolling in Medicaid under Molina?
Yes, so members can enroll in Medicaid anytime. If they're interested to see if they qualify, they can go to ACDC even to assist if they need some assistance. And there's also the Division of Welfare and Supportive Services offices located throughout the community. And they would fill out the application. They can also go online to access nevada.dwss.nv.gov to see if they qualify. If they're comfortable going online and they don't really have any questions, that's probably the quickest and easiest way to apply for Medicaid. And you can do that anytime during the year. And they'll fill out the application. They may have to provide some additional documents, and then the DWSS office will determine their eligibility for Medicaid. And the Medicaid open enrollment time, it can be a little bit confusing because there's different open enrollment dates for different lines of business, but the open enrollment time for Medicaid is now through the end of October, so through October 31st, and that is the time when members can switch plans. So if they're interested in making a switch to Molina Healthcare of Nevada, there's a form online that they can fill out, or if they find someone in the field from the DWSS office or from Molina Healthcare of Nevada, they can complete a switch form and mail that in or email that into the state to make a switch, and then that would be effective for January 1st of 2025.
Okay. All right, great. And we have reached the top of the hour. So do you have any advice to our community?
Yes, just check out Molina Healthcare of Nevada at our website, molinahealthcare.com/NV, or you can always give us a call, 833-657-0635 to learn more. We have some great events coming up for the holidays. We have a turkey giveaway on November 25th. We have a holiday to remember on December 15th, and also a winter wonderland coming up on December 9th. And so check out our website, the calendar of events. If you scroll down to the bottom where it says Molina in our community, you can always see any upcoming events for the month. And we would love to have the community come and join us.
Awesome. Well, I'm excited with the Winter Wonderland because we're working also with the Neighborhood Housing
Authority.
Yes. So we'll see you there as well.
Great. Thank you, Wise, for having me.
Oh, thank you, Kim, for sharing about Molina Healthcare and its resources and the wonderful work that you're doing for our community, especially being responsive to our community needs. So thank you so much. And again, for supporting ACDC with all of our work.
Yes, thank you.
Thank you, Kim. And if, again, mga kababayan, if you want to learn more about Molina Healthcare of Nevada, visit molinahealthcare.com or contact Kim directly. No, just kidding. And then, again, remember, open enrollment is the yearly period when you and your family can enroll in health insurance plans through Nevada Health Link. So it starts on November 1st and it will run through January 15, 2025. So get help from ACDC's health insurance navigators to help you to assist you in enrolling in health coverage and learn about all your health insurance options. So again, maraming salamat po for watching and listening Fil-Am in Focus, a program with the Asian Community Development Council. And for more information about ACDC, please visit our website at acdcnv.org. And if you like this episode, please visit our website, acdcnv.org again, and like our social media channels. Abangan po ang aming susunod na episode. Hanggat sa muli, maraming salamat po. And